Hi, Dr. Taylor here again. We're talking about stomach acidity issues. So to say stomach acidity, I can almost guarantee, most of you are thinking high acid is being an issue. Well, we're actually talking about low acid. So most of the things that you think go along with high acidity issues are actually caused by low acidity, or it's also known as hypochlorhydria in the stomach. So how do you know if you have low acid? Well, you probably have things like heartburn, GERD, indigestion, excessive belching, bloating, bad breath, loss of appetite for meat, a sense of fullness in the stomach, difficulty digesting fruit and veggies, or you have undigested food in your actual stool. So if you have these symptoms, you typically go into your general practitioner and say, hey, you should be taking this antacid, this proton pump inhibitor. It's going to really help you, and you take it, and lo and behold, you do feel better. But if it's a low acidity issue and you're lowering the acidity even more, isn't that a problem? You actually want acidity in the stomach. You want a good acidity in your stomach. The acid in your stomach is the first line of defense of any kind of pathogen that you encounter. So high acidity will kill those things. Low acidity lets them pass through, makes you more susceptible to disease. High acidity in your stomach, or proper acidity in your stomach, I should say, helps you digest food properly so you can get nutrients and minerals and all the good stuff out of there that you're supposed to. Undigested food passing through can give you things like leaky gut that leads to a whole plethora of other issues. Good acidity in the stomach also gives methyl groups. We talk about methylation or the genetic testing. Well, guess what? That really starts methyl group wise in the stomach with proper acidity. So when you lower the acid, or let's say you already have the low acid, those things aren't happening like they're supposed to, and then you take these medications or over-the-counter things like Tums to lower your acidity even more, these issues are worse. So like I say, high acidity in the stomach or proper acidity in the stomach is actually what you want. So why do you have the heartburn with the low acidity? How does that make sense? Well, when you have what's called the lower esophageal sphincter, so a little muscle that tightens at the top of the stomach. Well, that only tightens properly if you have a stomach acidity between 2.5 and 3. So the way acidity works, you look at the pH scale. You have 0 to 14. 7 being neutral. Anything above 7 is alkaline. Anything below 7 is acidic. So when we're looking at the acidity scale, the lower the number, the more acidic it is. So 2.5 to 3 is actually really acidic. And the reason that doesn't affect your stomach is you have a mucus layer in your stomach that keeps these acids from getting to the tissues and eating through them. You don't have the same mucus layer in your esophagus. So when that sphincter opens like it's not supposed to, and that acidity comes up through here, even if it's lowered, let's say 3.5 to 4, that's still really acidic. It'll start to wear away at these tissues, give the heartburn, maybe cause things like Barrett's esophagus, which can lead to a lot of different issues. That can turn into cancer. So what you need is proper acidity in the stomach so the sphincter will close like it's supposed to. What also happens when you have the low acidity in the stomach, food that you've eaten stays in your stomach longer than it's supposed to. When it stays there longer than it's supposed to, it either putrefies or becomes fermented, causes air, causes pressure to come up through here. It also causes lactic acid in the stomach, which gives you stomach pain. So that's why the low acidity causes all the symptoms. So when you take the antacids, that'll dampen the acid even more, which will decrease it. So like say maybe you're at a 4, maybe that takes it to a 5 or 6, which causes less pain up through the esophagus. Or you take that medication, and typically if it's like a proton pump inhibitor, what it does is it actually increases gastric motility. So the food that you've eaten actually passes through your stomach faster than it's supposed to, so then it doesn't have time to actually sit in your stomach and ferment and putrefy like we were talking about. Well, that's bad. Like we said before, is undigested food getting into the digestive tract cause things like leaky gut. And I say that just is a whole mess of issues you don't want. So stomach acidity is actually vital. You want stomach acidity. So you might be sitting there thinking, well, why hasn't anybody told me this information before? Well, there's billions of dollars in GERD medication, heartburn medication. I think it was the second behind statins. So there's a lot of things that you can learn doing things naturally. So, something you could do at home, you could start drinking some apple cider vinegar, put it in some water. You don't have to drink it straight or anything like that. That's not a super specific way to increase the acidity of your stomach to take care of these issues. We have a very specific protocol that we go through at our office. We typically give something called Gastroven. Do it for about 6 weeks. You open it up in water 30 minutes before your meal. That'll start increasing the acidity in your stomach slowly. It'll also heal any ulcers or any issues you might have in your stomach or esophagus area. And then what you'll do is you'll switch over to HCl, another product that we use, an HCl activator and digestive enzymes. You take 2 of those after every meal, and that'll start increasing the acidity in your stomach. Now what you do is you keep on that for a little while. Now I say a little while because I can't give it an exact reference because it's different for each patient. So you keep on that for a little while, and then you increase that to 3 of each of those after each meal, and then to 4. And you'll continue to do that until you get some kind of a reflux situation or feeling in your stomach. Once that occurs, say it happened at 5, then you're going to back down to 4. And then you're going to keep on that until you get the acid feel again, and then back to 3 until you get the acid feel again, then 2, then 1, and then you're off of it. The stomach acidity is corrected. You don't need to take anything else as long as you're doing the things that you're supposed to do. So stomach acidity, like I say, is a big issue, something you really need to look into because it can cause a lot of different issues if it's low. And the problem with the medications is you're almost hooked on them. There's not an easy way to get off of them. And if you have one of these and you've taken them before and you've tried to get off them, go cold turkey, guess what? Acid reflux comes right back. And then you'll say, I really need that proton pump inhibitor. I really need that antacid. You really don't. But what happens is you stop taking it, your stomach wants to be acidic. So you're fighting your own self. You stop taking it, your acidity skyrockets. And guess what? You get that heartburn right away. So man, I gotta chew on some Tums. I gotta eat this stuff right away to get this acidity back down. Well, acidity, like I say, is a good thing, but you have to really titrate it and do it in a very specific pattern to get off of it. Because these things, you almost become dependent on them. Once you're on them, you're almost on them forever. Now these medications are bad too. One of the things that they do is they decrease lysosomes in the body. Now every cell in your body has lysosomes except for red blood cells. So your mitochondria have lysosomes. So when you're taking these things like proton pump inhibitors, it decreases your actual ability to create energy. So you get fatigue if you're on these things too long. Proton pump inhibitors have been linked to chronic kidney disease. There was a study that came out not too long ago as far as a ridiculous amount. It's like 60% of people on PPIs were linked to having dementia, which is really, really high percentage of people to be linked to any specific disease or on a specific medication. But guess what? It didn't change the way that people prescribed or anything as far as the medication goes. I mean, most patients that I see that are on these, I might mention, hey, do you know that there's a 60% increase in people that take this medication and the risk of having dementia? And they'll say, no, I had no idea. I'm like, maybe you should ask your doctor. He should know this information. This information isn't new. It's not a secret. It's out there. So this is stuff they should know. This is stuff you should be communicated to or with your primary care physician. So like I said, this is just one of the many issues that we deal with on a daily basis here at our office, and it's super important. It seems like a small thing, but it's super important for health and for things that are needed. Like I say, even just breaking down food properly so you can get the enzymes out of them. You wonder why so many people, I recommend that you take a multivitamin. One, food is so depleted from bad soil depletion that you can't get all the nutrients typically out of a normal day's meal anyway. But then if you have low stomach acid, you're not absorbing these things anyway. So there's a lot of stuff that goes into it. But you should be informed, and there's lots of different things you can do to try to increase those. That's just, I say what I said. It was our protocol as far as increasing stomach acidity. I say you could go the apple cider vinegar route. It's just not very specific. We always like to be very specific to make sure there's a start and there's an end point to something. We don't want you to be on anything long term unless you really have to. So my name is Dr. Taylor, and I hope that helps.